Can lower back pain and disc degeneration has anything to do with heart health? Is the question I will be answering on today's episode of Ask Nutritionist Deepa. Thank you and welcome to today's episode. So, lower back pain is not unusual. Millions and millions of people suffer from back issues, specifically lower back pain and issues related to disc degeneration, which is along the spinal cord, because that's where those your lumbar is or the discs are. And people usually don't realize that this pain can get aggravated by something that is going on with their hearts. So let's see how that is all connected. um, so basically, we have an abdominal aorta, which is our main one of the main arteries, which takes blood. It's you can say it's a major pipeline which distributes the blood to other branching arteries. So, for example, from abdominal aorta or from that artery, which is a major pipeline, it goes to, I believe, four lumbar arteries, which means it takes the blood to our lower back, and then it also supplies blood to the middle sacral artery, which runs along your spinal cord. Um, so the sub arteries or branchial arteries or branching arteries from your abdominal aorta takes blood to your lower back and to your spinal cord. All right. So when we say it takes blood to these two areas, what does that mean? That along with blood, it also carries nutrients, because that's the whole point of having blood in your system, is that it's a carrier. It carries oxygen and it carries a lot of nutrients. Now, when there is a calcification or blockage or narrowing, maybe because of blood pressure, the blood supply to these arteries get affected, uh, because now, because of the narrowing, not enough blood is flowing through, and that results in the deficiency of oxygen. So your the blood cells or the muscles around that area is just going to be sluggish, because they are not getting the fuel that they need. They are also going to be lacking minerals and vitamins, which are extremely crucial for your back pain. I mean, for the bones of your back and the spinal cord. I mean, it's all calcium, it's all bone, it's our musculoskeletal system, which runs on nothing but good, robust vitamins, specifically calcium and um, vitamin D3 and potassium and zillion other vitamins and minerals and other compounds. So now we have a problem, right? We have these arteries which are either have a blockage or they are narrowed, and they are unable to carry the nutrient rich blood to your lower back or to your spinal cord. And that's why there is a back pain, or there is a disc degeneration or spondylitis. We can have all kinds of diagnoses related to this back pain, but the 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 root cause of that could be what is happening with your heart and your other the arteries, the main arteries that are related to your heart, because your heart is as you know, is a pumping machine, and all the abdominal aorta is again one of the major arteries, uh, which is connected to the blood supply to your back pain and your spinal cord. So that's how back pain and heart health could be related. So what can we do? What are some of the foods that we can focus on, which will help maintain that heart health, or to if possible reverse the blockage or remove the calcification and improve the uh, narrowing or prevent it from narrowing or reduce the blood pressure. So I have a list of 14 foods here, and if you make sure you stay to until the end of the presentation, because there will be a PDF, and also make sure guys to download all kinds of PDFs that I put on my website. We have some crave control, mm, recipe PDFs on my website, DuPage Dietitians. So make sure you go there and download those. But anyway, so I have a list of 14 different foods that are in our pantry and easily available, that can that will help improve the quality, the health of your heart. So here we go. Number one, berries. My goodness, blueberries, strawberries, blackberries, they are a powerful of polyphenols and antioxidants. What happens is, when we have calcification or a blockage or irritation, there is an oxidative stress, which means there is very bad inflammation and irritation. To reduce that inflammation, irritation, to reduce that oxidation, we need an antioxidant, and that's what berries provide. 3/4 cup or a 1 cup of berries, frozen, fresh, is going to help you get there. Number two, green leafy vegetables. Uh, Swiss chard, spinach, kale, turnip greens, beet greens. These robust green leafy vegetables have nitric oxide. Nitric oxide is again another a very powerful nutrient or a molecule we need, because nitric oxide, I call nitric oxide as a massage therapist, because when it touches the veins and the arteries, it helps you relax, and that thus improves the blood flow. So all these green vegetables are a rich source of nitric oxide, so make sure that you eat that to improve your blood pressure or to relax your arteries. Avocado, apart from, a perfect dip for a chip, I look at avocado as a source of potassium. We need potassium to release that nitric oxide that I just talked about. So make sure that you are eating avocado not with truckload of chips, but maybe with celery, because celery again is a rich source of potassium. So the more potassium in a natural format we provide, for our heart, the more nitric oxide it's going to help stimulate. And that's an easy one, right? The next, the number four, nuts. Actually, number 4 and 5, nuts and seeds. I'm going to tie them together because they both have similar nutrient content, omega 3s basically, and seeds have more fiber, so even more beneficial. The important thing about, specifically about nuts, is that we don't need again a bag or a cup or a big bowl of salted nuts here. 1 to 2 ounces. I always tell my clients, my patients, that 1 to 2 ounces, just think of the store 7-Eleven, at the most that many nuts you need in a day, not a cup or not an entire bag. And make sure those are unsalted raw nuts, because those are the one which are going to have the highest amount of omega 3s. And then of course the seed, the flaxseed, the chia, the sunflower, the poppies, and sesame seed, they all are going to offer the omegas and the other micronutrients. Number 6 on our list is dark chocolate. Again, a big antioxidant, is going to help us reduce that oxidative stress if there is any chemical toxicity going on, because we do consume, or we do get exposed, I should say, to toxins. Believe it or not, added oil like canola oil, uh, even coconut oil, excessive oil or added oils is a oxidative, contributes to oxidation. So we want to make sure that our diet is high in antioxidants. So dark chocolate is again one of those. I'm not talking about milk chocolate. I'm not talking about uh, the Hershey's Kisses and just your run of the mill chocolate here, guys. I'm talking about a dark chocolate which has at least 72% and higher amount of cacao in there, or you can try the raw cocoa or cacao powder. And again, it's going to help reduce the inflammation and irritation. Number 7 on the list, my favorite one, guess what? Beans and lentils. So easy, easily available. You talk about a superfood, it's cheap, it's easily available. There's never ever a shortage of beans and lentils in the market, and you don't have to spend more than $2 to get a bag of beans and lentils. So why beans and lentils for heart health? Because they have phytochemicals. Phytochemicals again help reduce inflammation, and they help reduce oxidative stress. The high fiber content, the low glycemic index also makes it more user friendly, in the sense it also helps with the blood sugar release and stabilizes the hormones in our system, thus helping our heart along the way. Um, just a tidbit about beans and lentils. The darker color beans and lentils, like black beans or azuki beans or brown lentils with skin, specifically lentils with skin on, are going to be more nutritious than your chickpeas, for example, or peas. So go for a slightly darker looking beans for antioxidant purposes. Now, that doesn't mean that white kidney beans or chickpeas are a no-no. They have another set of nutrients. I'm talking about the specific nutrients for heart health. And that's when the dark color beans like azuki, black bean, red bean, and brown lentils come in place. Number 8, tomato. Cooked tomato has lycopene. Gets activated when we cook tomato, and lycopene has shown to have heart benefits again by relaxing your heart muscle. Number 9, that next 1, 2, 3, 4, 5, 6 are going to be in your pantry, in your spice cabinet, I mean. So on number 9 we have turmeric. Who doesn't know turmeric is good for us anymore? I also saw the other day a turmeric in pet food. I mean, what can I say? Turmeric rocks. So turmeric, and again, antioxidant properties of turmeric, antifungal properties. It reduces oxidative stress. Um, Next online, number 10 is garlic. Garlic has particular compounds, they are called as alliums, and again help with reducing the oxidation here. The trick about garlic, or if you want to maximize the nutrient bioavailability of garlic, so to speak, then some research shows that if you crush the garlic versus chopping, so taking a wooden spoon and crushing it, not grating it, but crushing it, as if you are mad at somebody and you want to just crush something instead of, it's like a stress management technique that you can try along the way. So, crushing the garlic and letting it stay there for 5 minutes before you use in cooking. And when I talk about using garlic in cooking, I don't mean throwing it in hot oil. Of course, it smells good, but it's going to kill all the nutrients. When you throw spices in hot oil, it's going to kill it. So just add it directly to your broth, to your vegetables, to to get the most optimal things, most optimal health benefits. So again, taking the garlic, crushing it, and leaving it there for 5 minutes is going to be even more beneficial. Number 11, ginger. So ginger has something called gingerol. Uh, Again, anti-inflammatory. Ginger also helps vasodilation, which means it improves the blood flow to the arteries and veins by relaxing it. That's why many times, if you are having a headache or migraine, because when we have headache or migraine, our blood vessels are constricting. They are narrowing, and that's not good. So ginger, just taking a little bit of ginger with couple drops of lemon juice and pinch of sea salt. Again, I don't have a scientific proof here, but I have seen this as a home remedy used back in India by my grandmother and mother, and somehow it has worked. So I just thought I'll share with you. So that's how ginger works as an anti-inflammatory compound. Number 12, believe it or not, black pepper. Okay, no one looks at black pepper as a source of minerals, but black pepper has potassium and magnesium, one of the two key nutrients for heart health, for the functioning of the heart muscle. So adding a dash of black pepper in your tea or even in your oatmeal, anything sweet, if you just add a tiny little pinch of black pepper or cayenne, just adds a nice little punch to your meal, and gets this very beneficial foods in your body. So if you're not able to tolerate the spices at, you know then I would say start with a pinch. If you can't do the pinch, start with pinch of, like, dipping the toothpick in the spices and mixing it in your soup or even smoothie. I have been drinking a smoothie where I add a pinch of sea salt and cayenne and black pepper in my green juice. So that, so make sure you guys try some black pepper. Number 13, cinnamon. What does cinnamon do? Again, it improves the nitric oxide. Like I said, nitric oxide helps our blood vessels, arteries, and veins relax, and thus improving our blood pressure. So cinnamon is going to be another important one. And the last but not the least, cilantro. How hard it is to start using cilantro. Cilantro helps with detoxing, as well as there are a couple of studies which show that cilantro helps with dissolving the blood clots. I mean, how powerful can food be if it's able to dissolve the blood clot or reduce the blood clot formation? So cilantro again is very easy to use. My recommendation would be getting the fresh cilantro and not again throwing it in oil, or exposing it to heat too much. I would use it in pesto. I would use cilantro more as a on top, more like an herb, to infuse the flavor. Again, you can add a just few strings of cilantro in your smoothie, just to add more nutrition and punch. So that's how low your back pain or any type of disc degeneration, or any issues with your spinal cord related pain and your heart health is connected. I hope you guys will implement some of these ideas. Let your questions mm, keep coming. I really enjoy them, and thank you for watching. Make sure you download the PDFs from the website dupagedietitians.com, and very soon we will also have them on nutritionistdeepa.com. So either way, stay in touch, and I will talk to you soon.